Hi, my name is Goodluck Minja from Global Health Corps. I'm working with Clinton Foundation as Health Management Information System Officer.
I'm Andrew Peterson. I'm a Global Health Corps Fellow working with Goodluck Minja in Tanzania. We work with the Clinton Health Access Initiative on health information systems. The Health Information System in Tanzania is a series of paper-based medical registers and reporting forms that record and aggregate patient information from health facilities. This data is integral to the Ministry of Health for evaluating the effectiveness of various clinical programs, tracking community health trends, and providing the backbone for the planning and allocation of budgets and human resources throughout Tanzania. These systems, however, are plagued with inaccuracies for a variety of reasons. Our project has been to focus on the data collection process in end-of-line facilities in one specific district of Tanzania, define the causes and scope of the problem, and design and implement solutions that, if successful, will be replicated in other parts of the country. Our initial research suggested that while Ministry of Health officials hadn't yet quantified the depth or scope of the problems with their data, various audits and certainly anecdotal evidence suggested that inaccurate data was pervasive. Most officials cited human resource problems being responsible for the inaccuracies. Many believe that staff in end-of-line facilities, the people who collect the majority of the data for the entire country, lack the skills and manpower to collect quality data. When actually visiting those facilities, however, we found that workers were often more comprehensively knowledgeable about medical practices and clinical programs than most staff members at the district level and above. As opposed to hospitals that have upwards of 40 specialized staff members, these end-of-line facilities typically have only 3 workers covering all clinical programs for a catchment area of up to 10,000 people. Consequently, they're overworked and are in desperate need of support. And with only a handful of health system managers to support many facilities over large physical areas, these facilities and their staff are largely neglected. Medical staff are then forced to prioritize their time and typically favor activities resulting in direct delivery of medical care. Capturing and reporting quality data is a low priority because forms can be confusing, management doesn't seem to care what numbers are reported, and facilities have never been taught how to use the data for themselves. All these factors combine to result in data that is, in the best cases, mildly inaccurate, and in the worst cases, entirely fabricated. The goal of our work has been to find a way to increase the accuracy of data being reported in end-of-line facilities. To achieve this goal, we focused our solution on 2 groups, district managers and the end-of-line facility staff. We spent a lot of our initial time working with the district management team to improve their use and value of data so that they, as the management team, could set the example for the rest of the end facilities. We set up monthly check-in meetings where the team reviews and analyzes health data for the district from the previous month, and we ensured their collaboration and support to the work we wanted to do with the rest of the district facilities. For end-of-line facility staff, we broke down the 50 district facilities into regional groups of 10 to create community hubs and concentrated our work with them in 2-month cycles. In those 2 months, we partnered with the district management staff to conduct a series of one-on-one on-site training visits, historical data assessments, supply audits, and restocking of much-needed drugs, vaccines, and medical equipment. Again, partnering with district management staff, we conducted day-long data workshops where staff members from the 10 facilities completed various tests and team activities designed to increase their knowledge and skills around data collection, promote teamwork, and encourage the use of data in facilities budgeting and planning processes. Every step along the way, we've infused the message of how and why quality data is important to raise the prioritization of data-related activities at the health facilities. Our program has empowered and capacitated facility staff with much-needed data validation and compilation skills to ensure quality data, while simultaneously helping district managers make good on their commitment to support the facilities and build an overall healthy system. Before training, Many data forms were confusing, which led me to record inaccurate data and send poor reports. But after attending the training program, I now see a big improvement on my data management skills. From now on, I will focus on improving the way I am collecting data in my facility, because I understand the importance of data and how to use it while creating my future work plans. We have made big achievements in a very short time. Sitting with the staff at their own facilities and filling reports together gave our staff more confidence and understanding. We have also built a spirit of teamwork by having facility staff teach each other while doing data exercises at the data workshops. We even strengthened communication between the district managers and our facilities because we assured it was okay to ask for assistance from the managers once they were confused or stuck on filling reports or registers. There's even good teamwork between one health facility to another. Now they communicate and support each other when solving problems in data collection and reporting. After participating in the data training program, the job is easier for me. I now understand the confusing parts of the data collection and reporting forms, and I'm enjoying my job much more. Tests that we've administered to end-of-line facility staff during our training module have yielded evidence to support participants increase their data accuracy by 3 times. Additionally, we've recently gathered evidence that suggests our strategy has had a lasting and compounding effect on the increase of data accuracy in the district. 6 months after initiating our program with a given facility, staff members have shown continued improvement in data quality beyond what we initially recorded. This means not only have they retained the skills learned over the short-term 2-month training period, but have actually applied the tools and strategies we equipped them with to continue to learn and improve beyond what we taught them without our help. While we were able to complete this training program over the year, it's obvious that continued support and supervision is necessary, albeit impossible with the current management and support structure. Therefore, we have been working with the district management team to design and roll out a decentralized management support structure with locally based mentors to build on the work that we have completed over the year. We have identified the best staff members from end-of-line facilities throughout Kilwa to become mentors to assist their nearby facilities in data management and improve health services. We will work very closely with them to ensure each facility is reporting accurate data, as well as reporting what each facility needs in terms of health equipment, drugs, registers, and forms. This new decentralized management structure will provide more support for each facility at a reduced cost to the district. Our main goal for the next 6 months of this project is to make sure that all data is collected and reported accurately from every one of our 50 facilities. On previous days, you may go to some health facilities and find out that they have not filled their registers or have not sent some reports for 3 months because no supervision takes place over that time period. With this mentorship program, we can visit them every month and assess their data. The District of Kilwa has made impressive strides in improving the quality of the health data collected and reported over the year. With this mentorship structure in place, we hope Kilwa will be the example to the rest of Tanzania of a health system that values and utilizes quality data to improve the healthcare delivered to the community it serves.